Hey there, this is Joseph Pate, better known as Medicare Joe, and I wanted to make this 10-minute Medicare presentation to give folks that might not have the most time to dedicate to learning this stuff a quick breakdown of what Medicare is, what you need to do with it, how to do it, all within a 10-minute session. So I'm not going to bore you with my credentials and why you should listen to me. MedicareJoe.org is our website. You can Google us, Medicare Joe LLC. We have over 600 plus 5-star Google reviews there. But I'm going to dive right into the content. So again, here's our information if you want to take a screenshot of the screen here. But I'm going to dive into what Medicare is and the most efficient way for you to learn it within 10 minutes. So we always talk about the steps of Medicare, the steps to understanding Medicare. And the first step to understand is, do I need to start Medicare at 65? So when you're turning 65, you have the option either start it or delay it. The second step is going to be, should I get a Medicare supplement plan or a Medicare Advantage plan? We refer to that as the two roads to Medicare. And then the third step is enrollment. How and when do I enroll in a plan? So we're going to go over all three of these steps within this 10-minute video. And we're going to start with step one, which is, do I need to start Medicare or delay Medicare at 65? So if someone's turning 65, they will have the option to start their Medicare on the first day of their birth month, unless their birthday's on the first of a month. If their birthday's on the first of a month, they will actually start their Medicare the month before their birth month, as shown in the example here on the slide. But again, if this is when we can start it, how do we know if it makes sense for us to start it? Well, this is going to be based on if you're still working and have coverage through your employer. So if somebody is not actively employed or their spouse is not actively employed, they will need to start Medicare at 65. But for folks that are still actively working or their spouse is actively working, and they're on that employer-based plan, and there's more than 20 employees that work for that company, they have the option typically to delay their Medicare enrollment until they decide to retire. There's a couple of reasons why someone would want to delay their Medicare enrollment until a later date, and I've listed a few of them here. Monthly premiums is probably the biggest one. If someone's paying a small amount through an employer plan compared to the cost of Medicare, it might be wise to delay. Maybe they have dependents that are dependent on them to have the employer-based plan. They would have to ideally delay their Medicare enrollment till the spouse maybe is of age to turn 65 and get onto Medicare as well. And as you can see here, there's some other scenarios. So with original Medicare and starting that in terms of cost, this is the cost of getting onto original Medicare. Your bare minimum cost is $174.70. That's your monthly premium. So comparing that to your work plan is what you're going to want to do to see if it makes sense for you to start Medicare. Now, for folks that are going to start Medicare, they are going to have Part A and Part B, and they're going to have to make the decision of the two roads of Medicare, which is a Medicare supplement plan versus a Medicare Advantage plan. And how this will look is you'll have original Medicare A and B as a primary if you choose the supplement route. You'll have your Medicare supplement as a secondary, and you'll have a prescription drug plan. This is one way that someone's insurance can be set up when on Medicare. The other option is Medicare Advantage. This is the alternative to Medicare A and B, and you'd have a hospital rider that you'd add to this typically. These are the two ways when someone is getting onto Medicare, they have to pick one of these sides. They can't have both. So I'm going to go over the left side first, which is original Medicare, and talk about how that'll work. So if someone chooses the original Medicare route, they're going to be covered at 80% through original Medicare, and the supplement is going to cover them at 20%. Basically, what you're doing with the original Medicare option is you're paying an additional monthly premium for the supplement plan to avoid having to pay medical bills. In the Medicare and You guidebook, there's this confusing chart that talks about Medicare supplement plans The main two that people can pick from, which make the most sense, are Plan G and Plan N. Aside from this chart and this how confusing this can be, the simple way to look at this is if you choose Original Medicare with a supplement and you choose Plan G, the only thing that you're going to have to pay for is your Part B deductible, which is $240 for the year. So if you have the worst year that you can imagine, that's all you're paying is a $240 deductible for the year. Plan N, very similar to G, you have the same $240 deductible, but if you were to go to the doctor after that, they can charge you a $20 copay. And if you go to the ER, they can charge you about a $50 copay. So if we choose Original Medicare with the supplement, we're going to be picking either Plan G or Plan N to act as our supplement. And these are the costs you can expect to pay with medical bills with those plans. There's a lot of benefits to a Medicare supplement plan. You can use any doctor or hospital that you wish. Your primary insurance stays as Medicare. There's no referrals or surprise medical bills that pop up, and there's relatively no or very low out-of-pocket exposure. Some of the disadvantages, though, that come with this side is it does require you to pay an additional premium for the supplement plan. It doesn't come with dental coverage. That's also required at additional premium. And it does not include drug coverage, which you can purchase at an additional premium as well. Your total cost for the Medicare supplement side, this is the breakdown. You'd have your $174 for Medicare. The supplement plans will range based on your state and based on the Plan G or Plan N. But you're looking at $70 to $150 typically in most states, a drug plan premium. So here's what you're going to be looking at all in on a Medicare supplement option, which again is the left side of this chart. The right side, Medicare Advantage, Part C, how this works is ultimately they're going to take your Part A, your Part B, and your Part D. So think of all of the original Medicare parts, and they're going to lump it into a managed care organization. So you're going to have one card for everything in this situation. You're going to be insured by an insurance carrier for everything. And it's going to be through an HMO or a PPO. Now this is very similar to employer-based coverage. You're going to have to pay co-pays for doctor bills, tests. You're going to have a network of doctors. And your medical maximum out of pocket for the year in terms of what your exposure is with medical bills will range from $5,000 to $8,000 a year, depending on the plan that you pick. There's a lot of benefits to Medicare Advantage with the hospital rider. There's no additional premium for an Advantage plan. It includes dental, vision, hearing. It includes drug coverage. It comes with extra benefits like gym memberships and so forth. But there's also a lot of disadvantages as well that come with this. You're going to pay co-payments for pretty much every service outside of a primary care doctor. So I listed some here: specialist 35, ER 100. The biggest one being cancer. So with cancer, you'll have a 20% co-insurance for cancer treatment. And skilled nursing facility, if you need any type of skilled nursing care, there's co-pays for that after the first 20 days. So again, this is the Medicare Advantage side can be restrictive to networks of doctors. There's referrals that might be required. And you may have to health qualify if you ever want to get to the supplement plan again later on in the future, which is the left side. So in terms of the Advantage plan cost and what we can expect with that, this is definitely going to be a lower cost on the left side, but it does come with lower quality. So you can have, basically you'll be looking at your $174.70 premium for Medicare, and then a $25 copay for the hospital rider. So total premium together, you're looking at about $200 a month if you chose the right side. So at this point, let's circle which option you think makes the most sense for you just off of this short video. And let's talk a little bit about how and when do I need to sign up. So if you're already receiving Social Security benefits, then you'll automatically be enrolled into Medicare A and B. You'll get your Medicare card 3 months before turning 65, and that Part B premium is going to come right out of your Social Security. So ultimately, if you're receiving Social Security, there's not much action you need to do to get Medicare A and B. If you're not receiving Social Security, you're going to need to sign up 3 months before your birth month for both A and B. And that premium, the Part B premium, will actually be billed to you quarterly, as you can see below here, until you start to receive Social Security. Then it comes out monthly. If you choose the Medicare supplement option, the best time to enroll in these plans, again, original Medicare I just went over, happens 3 months before your birth month. The Medicare supplement plan happens 6 months before your birth month in most states. So they allow you to lock in premiums 6 months in advance of the effective date so you can get the lowest rates possible. And then the drug plan is going to happen 60 days before your birth month. If we're looking at Medicare Advantage as the option, the timeline for enrolling is going to align with your Medicare enrollment. So you'll need to enroll into Medicare A and B 3 months before, and then that is when you'll also be eligible to pick your Medicare Advantage plan, which will be, again, 3 months before your birth month. So one of the most important questions that we get is, why should I use an insurance broker to help me with this? Well, our service, number one, is completely free to the client. You're getting an unbiased advisor in your corner at no cost. We're paid directly by insurance carriers via commission each year that you are on a plan with us. So there's an incentive there to always keep you in the best plan and continuously shop your plan. And then lastly, we're independent agents. So we do not work for one specific company. We work with multiple carriers, and this allows us to give you an unbiased opinion on your situation. As a matter of fact, here are all the carriers that we work with, and we're not biased to one over another. Whichever company is the best for our client is who we're going to recommend. So you've watched this 10-minute Medicare presentation, and the biggest question at this point for you is, where do I go from here? Well, some of you might be still in stage one, which is gathering Medicare education. You watched the presentation today. But stage two, everybody will eventually get to this point. You need to get enrollment advice. Everybody's situation is different. And during the enrollment advice that we provide, you're able to schedule a free consultation to discuss your specific situation. This 10-minute Medicare session obviously would be a lot more tailored to your specific situation on that call. And we give you 2 free bonus items. One's a personalized enrollment timeline, and the second is a Medicare cost breakdown. Ultimately, this goes over what you need to do, when you need to do it, and the most efficient way to do that possible. And then stage 3, once you've signed up for Medicare and you enrolled, you want to make sure whichever company you're working with provides you with lifetime support. So this is going to be lifetime customer service, whether it's claim issues, rate increases, just questions you might have on your insurance. You want to make sure that they have the capability to do that. Our team here has a whole customer service department dedicated to customer service related issues and helping folks with that. And make sure they do free annual reviews. So this is probably the most important, making sure that you are constantly in the best position with your plan each and every year to make sure that you are paying the best and lowest rate. So again, thank you for joining this 10-minute Medicare presentation. Hope you learned a little bit from it. Obviously, it's only 10 minutes, so we can only give you so much information in that. So there, somewhere on this page, you'll probably have a link to contact us, book a call. If you're looking for more information tailored to your specific situation, my team of agents here would be happy to help.